top 5 things that all moms need to know before they become a patient in the hospital? Hey moms, I'm Dr. Shaunna Mason. I'm a board certified OBGYN practicing here in Houston, Texas, helping moms know more about their bodies as they get ready to have babies and as they recover postpartum. So for most of my patients, I find that having a baby is the first time that many of them have ever been admitted to the hospital. And so while we focus a lot on how your pregnancy is going and how the baby's moving and what to expect when you go into labor and when to know to go to the hospital, I find that we don't always cover what it's going to be like to be a patient in the hospital. So I wanted to cover the top 5 things that all moms need to know so that there are less surprises once you get admitted to the hospital. So this is for you moms who are not planning on, okay, cut that part. Okay. One of the things that surprises many of my patients are consent forms. So consent forms are basically permission slips for the hospital team to take care of you while you're at the hospital. And so we need these permission slips basically to cover things that you may not be expecting to happen to you, but that could happen to you while you are in labor or admitted to the hospital. This allows us to understand what your expectations are for providing you care in case you become unconscious or incapacitated at some point during your admission. Now, these often feel like people's worst case scenarios that they are then signing permission for, right? So unfortunately, there can be complications in having a baby, both vaginal deliveries and C-sections. Things like tearing that might need stitches to repair, hemorrhages or significant life-threatening blood losses, infections, complications where we may need to do further procedures in order to fix damage or cut that part. And anticipating what complications could arise and trying to understand what your goals and desires are in case those things happen. Now, many patients feel like when given a consent form, they're accepting or saying yes to things like a vacuum delivery or a C-section or a blood transfusion. It's not exactly what you're saying. It's just that you're thinking through worst case scenarios with your team so that we understand how you feel about those things before we are having to navigate very quick counseling and quick updates as to what we need to do to potentially save your life, right? So I think it's sort of your emergency action plan, if you will, right? Nobody wants to have a fire in their house, but we keep fire extinguishers and fire blankets, and we have maybe ladders that help us get out of the second floor, right? We come prepared for worst case scenarios, even though having to go through that would be horrible. So when you sign consent forms, it often covers both complications and risk of having a vaginal delivery, as well as a C-section, as well as an epidural, even if maybe you're not planning on an epidural. And again, this is not because we want any of those things to happen to you. We just want to be able to have that conversation, talk to you through the risks of things, and understand what your goals are so that we can do our very best to take great care of you, even in very dangerous emergent situations. Okay, second is you won't see your doctor as much as you think you will. So nurses are really the unsung heroes of hospitals, right? They are our boots on the ground. They are the ones side by side with you, checking your vitals, checking how you're feeling, administering medications, and working very hard to help you through your labor process. And they keep us updated in real time. Nurses often have a smaller amount of patients than doctors have to take care of. So your labor nurse will likely only be taking care of you or maybe one other patient. They're not managing the whole unit. Your doctor may have several patients in labor that day, so they need a nurse side by side with you, helping them get you to your goal of a safe and healthy delivery. Postpartum nurses are with you throughout your recovery. They are often taking care of a couple patients every hospital is a little different, but now many postpartum nurses will take care of both you and your baby. We call that tandem care. That we hope limits disruption, so only one nurse is coming in to evaluate you and the baby, and it's not multiple people coming at different times. And it's somebody that kind of knows you both as a unit, right? Now, not all hospitals are that way, but many have moved towards that. And so your nurse will help you understand how your recovery is going and help you navigate your pain medicine, navigate your bleeding expectations, make sure you understand what your vitals are doing. And she will keep your doctor informed of things that aren't going so smoothly or things that she is also concerned may be affecting your recovery. And then your doctor can update orders based on what her assessment is, right? Doctors often round every day that you're there, and so you'll see someone from your care team to help you understand how your recovery is going, what their recommendations are to help you through obstacles and expectations for discharge. But your nurse is really who you're going to be seeing most of the time. Nurses work in shifts. At most hospitals, nurses work 12-hour shifts, so 7 o'clock in the morning to 7 o'clock at night. When those hours or shift changes are happening, your nurses often come in as a team and hand off your care. So they come in and they talk about you and talk about your baby in front of you. That way you can hear what their assessment of you is and you can validate it or make updates. Actually, that's not the medicine I'm taking, or actually, that's not what I think is happening. And you can be an active participant in the people taking care of you. So I think people sometimes don't expect how many nurses they might meet throughout the course of their hospital stay. If your labor is taking a long time, then you might meet a couple of nurses through your labor process. And then if you're in the hospital for a few days recovering with your baby, you might meet a few more nurses. And I think this flow of nurses is very normal to us who work in the hospital, but I think patients aren't always expecting to meet so many new people and feel like their care is being handed off so often. But that's why we've moved to that in-room handoff most of the time. That way you know exactly what one nurse is telling the next nurse, and you feel confident in that handoff and transition of your care. Number 3, you will probably need an IV, and you will probably meet with an anesthesia team, even if you are not planning on having an epidural. I think a lot of my patients get really surprised by this, and they don't want an IV, and they don't want to talk to anyone about an epidural or a C-section because that is not their plan. But this is how we look at it. Our job is to keep you safe. And we know, because we do this all the time, that things can take a turn for the emergency quickly in labor and delivery. And so it's really important that the anesthesia team, who may then be participating in your care in an emergency situation, know all the things about you that may affect their ability to provide you great care. For instance, if you have a history of scoliosis or a pelvic fracture because of a car accident when you were young, the anesthesiologists need to know that so they can anticipate whether they're going to need to do things differently if you were to need an emergency C-section, or if you were to change your mind and decide you want an epidural at some point during your labor course. So in many hospitals, the anesthesia liaison, whether that's the nurse or this nurse anesthetist or the physician, will come by and review your history, go over all of your labs, go over any medications you're taking, and make sure there are no parts of your history that might affect their ability to take great care of you in case you were to need them, not because we are suggesting you need them or expecting you to need them. We actually would love for you to have a natural labor and not get an epidural if that is your goal. So think about it more as just your emergency action plan again, right? That the team gets to know about you when we are not in a stressful emergency situation, when you have time to ask questions and think about things, and they're the expert when it comes to anesthesia during your labor course, whether that is an epidural for vaginal deliveries or epidural or even general anesthesia in the case of emergency C-section sometimes. We also encourage IV access at most hospitals. An IV is a small catheter that is placed into one of your large veins, usually in your arm, your wrist, your hand, your elbow. Our nurses place these most of the time, and they are very thoughtful about where your veins seem very strong and where it won't be so uncomfortable for you throughout your labor course. So they think about things like how will it feel once you're pushing and making sure that we're not blocking it or it's not causing you pain. There's no needles that are left in. This is a common misconception. It is placed with a needle initially, but then just a small catheter stays in the vein so that we can administer medications through it or IV fluids if you were to need throughout your labor course. While many hospitals support that IV being what we called saline locked, so the catheter is in place in your vein, but it's not hooked up to anything unless you need it. This is something you may want to talk to your doctor about what their philosophies are. Labor is a really exhausting part of your journey to birthing your baby, and it can dehydrate you very quickly. So if you're having trouble staying well hydrated in labor, think about running a marathon, right? Your body is working in overdrive. Then your doctor may suggest that you consider IV fluid so that we can help you stay hydrated throughout your labor course. Now, if you're doing great staying hydrated on your own, you probably don't need it. But we need this IV access most of the time, again, in case of those emergency situations where we may only have minutes to act to save your life or save the baby's life. And finding IV access can actually be really challenging in those stressful emergency situations. Number 4, most medications that you can get in the hospital are ordered as needed. What this means is they are available to you to ask for if you are needing them, but they aren't actually offered to you all the time. These include medications we expect you to need as you recover from having your baby or things you may need while you're in labor. Everything from Tylenol and ibuprofen to gas medicine to nausea medicine and constipation medicine, things like heating pads, abdominal binders, and hemorrhoid pillows are all available to you if you need them. Now, not everybody needs them, and so I think just understanding that this stuff is available to you and working with your nurse to ask for the things you need. I find that many patients don't even know they can ask for this stuff because it's not actually being offered to them. So if you are struggling with headaches, with pain, with reflux, with nausea, with constipation after you have your baby, any of these things, make sure you mention it to your nurse and your doctor to see what is available for you. Sometimes you just need to know to ask for it, and then you will feel so much better. This includes strong pain medicine like narcotics. So not every mom, including moms who have C-section, want or need narcotic pain medicine. Even though you've had major surgery, it is expected for you to need pain medicine throughout your recovery. We have taken out the narcotics from anti-inflammatory and over-the-counter pain medicines like ibuprofen and Tylenol. These are often given to you or offered more often because they are sort of the safest, basic medications that help lots of people start to manage their pain after a vaginal delivery or a C-section. But many moms have pain beyond what those medications are capable of controlling, and there is often narcotic or stronger pain medicines available for you to ask for as needed. You want to work with your doctor on what you should expect to need, right? Some moms may need a stronger pain medicine every 4 hours or 6 hours or 8 hours. So sort of coming up with a strategy on how you're never going too long without something may limit the overall daily needs for stronger narcotics. You can kind of space them out a little bit if you're using some of the more basic over-the-counter medications in between. But again, understanding what's available for you, understanding that if your pain is above a certain level, it is very, very reasonable for you to need something stronger. Don't feel like because it's not being offered to you that you shouldn't ask for it. It's just that we want to make sure that we give patients exactly what they need and try to individualize that care. But it's by no means made to make you feel like you shouldn't be asking for them because they aren't being offered to you. So again, work with your nurse, manage your expectations of what your pain should be, and find a regimen that works for you so that you can start recovering, you can move your body and not be in severe pain, and start to be on your journey to feeling more back to normal after you have a baby. And number 5 is you are your baby's legal guardian from birth. What this means is you are their decision maker from birth. This is everything from advocating for skin to skin and delayed cord clamping to when they get their first bath, whether you want them to go to the nursery, whether you want them to go to the nursery, things like circumcision, vaccines, medications that may be administered after birth. You are this baby's voice, and so it's really important that you have a clear understanding of what they are recommending for your baby, right? It's not that we want you to feel like every decision is of utmost stress. A lot of these things are recommended because of great research that can really benefit your baby. But I think it's really important to understand this level of responsibility, to ask questions, to make sure you know exactly what's being given and why, and make sure you feel really comfortable in the care that you are now navigating for your baby with your pediatrician and with your nursing staff. It is a wonderful responsibility to become a parent. And we have our children's best interest at heart, and we want to do everything right. And your healthcare team is part of accomplishing that goal, right? They are the experts that are there to help you understand your baby's test results, your baby's physical exam, what their vitals mean, how to learn that they are transitioning into our world in a normal, non-concerning way, right? Are they eating enough? Are they having enough wet diapers? Have they had their first stool? Is their body temperature normal? And nurses and your pediatrician can be so helpful in you understanding all of this stuff so that you can build that confidence as a new mom and advocate for your baby exactly how you want, to make sure that that you're feeling a part of that decision-making team. So don't be afraid to speak up. Don't be afraid to ask questions and feel confident in the decisions that you're making for your baby. So I hope this video is helpful. I know being a patient in the hospital for the first time can be incredibly stressful. It can also be so exciting and can be a wonderful experience if you feel confident navigating the healthcare system. Don't ever be afraid to speak up if something doesn't feel quite right. We want to take great care of you, your doctors, your nurses, all of the staff at the hospital. And we're really familiar with the system, but we know sometimes this is your first experience and we want to make it amazing.